Heart failure with preserved ejection fraction, HFpEF, is a type of heart failure that doctors say makes up nearly half of all cases. Once someone is told they have HFpEF, they often face many medications, frequent doctor visits, and strict monitoring. Even with all this, the average life expectancy is only about 5 years, similar to some cancers. For such a serious condition, you would expect doctors to have a clear and reliable way to diagnose it. Unfortunately, that is not the case. The main problem is how to measure how well the heart relaxes and fills with blood, called diastolic function. The most direct and reliable way to measure this is with something called tau, which tells how quickly the heart muscle relaxes after squeezing. Doctors have known for decades that tau is the gold standard for judging this part of heart function. However, the professional guidelines that doctors use have avoided tau. Earlier guidelines promoted a flawed method from Harvard that simply didn't work in everyday practice. The most recent guideline, released in July 2025, quietly dropped that method but did not replace it with a better one. Instead, it tells doctors to rely on several indirect signs, which are not very accurate. Adding up several weak clues does not create a strong answer. So is tau impossible to measure in everyday heart scans? Actually, no. Since 2017, a method has been available in China that allows tau to be measured non-invasively, at least in certain patients. But this progress has been ignored in American and European guidelines. As a result, tau has almost become a forbidden topic, and many patients may be misdiagnosed. When tau-based testing is compared with current guideline methods, almost half of the results do not match. For patients, this raises a troubling question. If the diagnosis itself may be uncertain, how reliable are the treatments that follow? For now, patients with HFpEF should know that the diagnosis is not always clear-cut. If you or a loved one is told to have HFpEF, it is reasonable to ask your doctor how confident they are in the diagnosis, what tests were used, and whether a second opinion might help. Until tau measurement becomes standard, caution is wise.